Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Hey guys, I am actually really excited about this episode.
I think it's funny you're excited about this because I'm like, it's a checklist. Like,
No.
What is exciting about this episode?
I'm such a, is it a type A person that does checklists?
Yeah.
Yeah. Okay. Well, I mean, pretty much everything that I do is in a list, and I plan my schedule, and I like to have a plan. That's just how I live. So when we were coming up with the outline of podcasts and we said we were going to do a before surgery checklist, I think my insides got giddy.
You are such a nerd.
I know.
You are such a nerd.
It.
Because I'm a list. I mean, I like to be prepared and I like to have lists, I guess, but I don't get giddy over them.
Oh, geez.
So I'm excited that you're excited about our trip.
Oh, yes.
I'm thrilled for you. I just want you to know that. I'm so happy.
I'm the person that when we're going on a vacation, I'm like, great, let me go make a list.
Oh my gosh. You're so
love lists.
funny. All right. Yeah. So on that note, let's talk about this. What are we going to talk about today? We want to talk about surgery expectations, right? And things you might need or want. What do you think? What else?
Yeah, I think we have this conversation a lot with people that we're mentoring is just what to expect. What do you need to do to prepare for surgery? You know, what do you potentially physically need?
What things did we find helpful, right?
Right. Yep. And then we'll wrap up with the specific items to consider for surgery and how to prep for it.
Oh, okay. Well, I think that sounds helpful, Sarah. Before we get into that, though, let's hear from our first sponsor. Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at paxmanscalpcooling.com. That's paxmanscalpcooling.com.
So we're back. So Beth, as someone who is a total list maker like myself and preparer, I want to hear what steps you took to prepare for surgery.
Yeah, I didn't take any steps.
Oh, God, I'm so scared.
I didn't. I think we're seeing a reoccurring theme here where I was just kind of along for the ride and people told me where to go and what to do and I just did it. Mm-hmm. But I will say that I had one experience where a nurse had suggested that I sleep sitting up after my surgery. And that led me to find a really cool organization that was providing recliners for women who have had double mastectomies. So I was the benefit of that service. And that I cannot express enough how much that aided my recovery. Mm-hmm. So if there's one bright spot in my surgery recovery, it was getting that chair and being able to sleep in that to recover comfortably. Mm-hmm. So I would say that that's probably the biggest thing that I did to recover. And we can talk about that a little bit more. If you go and if you need a recliner, there's organizations that provide them. There's an organization in St. Louis called Valida's Hope who provided my chair. There's also the healing chair. And if you want to buy your own, you can get them for $300 at Value City Furniture. So, but for me, yeah, that was huge to my recovery.
Yeah, same. I had heard about the recliner. I had got a recliner for Henley's room. She was an infant at the time, so I did a lot of, nursing and rocking when I could. And so I had that recliner. But I think for me, what was my huge saving grace was I had invested in a wedge pillow. which is the same
So
concept.
you're pro wedge.
I am pro wedge all the way.
I feel like women are either pro or anti wedge. I'm an anti wedger.
Oh, why are you an anti-wedger?
I bought a really expensive one and I hated it.
Why?
I don't know. I don't know. But initially, I had a wedge and a recliner. I was like super spoiled, but I did not care for it.
Interesting.
I found it hard to sleep on. I didn't like the angle. It was good for sitting up during the day, just not for me sleeping comfortably.
Yeah. Interesting.
So that was just me. But it's funny because women are either pro or anti-wedge.
Yeah. Both are really nice to have around because I felt like when I got tired of being on the wedge, I could go sit in the recliner. But when, the recliner wasn't comfortable, just because, if you think about like when you're sick or something, like being in one place the whole time,
right.
I just need to see something different. I need to feel something different.
Right.
So having the option of both is really, really nice.
Wait, before we go on, can I ask you a question that has nothing to do with what we're talking about?
Oh my. Yeah.
Okay. So I used to do this thing. I haven't done it in a long time, but like when you're sleeping in your bed, you know how sometimes you go to bed and your bed's just so comfortable that night and you're like, I'm going to sleep awesome because my bed feels amazing. And then other nights you lay down and you're like, I don't know if this is going to get it done. Like I'm not feeling comfy. I will actually I think because to your point, like when you lay in the same spot all the time. So like I will go the opposite direction. Like I will put my head where my feet normally go. Do you not do that?
No. First of all, if I did that, I would be sleeping with my husband's feet. That sounds not great.
Okay, never mind.
Okay. Well, you're unique.
Let's get back on topic.
Okay. Back to the wedge. I think we should probably explain why the wedge for anybody who is
or what it is.
Yeah, or what it is. So the wedge puts you at, I would say there's all kinds of different wedges, but it'll put you somewhere between like 30 degrees inclined to 45, just to kind of depend. And I think that there's really fancy ones out there that are adjustable, that you can kind of flip a pillow one way and the other way and adjust it to be more or less wedge. But it's really difficult to lay back all the way to have the weight of your chest when you're fully on your back after surgery. So being at an inclined position really helps with the pain, and you're not...
And the drainage.
And the drainage, yes. And because sometimes after my last surgery, when my abs and my gut felt so punched, just using my core muscles to recline was really, really difficult. And that wedge was a lifesaver.
Yeah.
So yeah, it's really handy to have.
We agree you need to invest in some sort of supportive apparatus, though,
yes,
right?
Yes.
Like there is no way you should be laying flat in a normal bed.
No.
Yeah,
no.
Agree.
Yeah.
I don't know how you would do it, honestly.
Yeah.
Like when the nurse told me that, I called my insurance company and asked for a hospital bed naively because they were like, no.
Yeah.
But yeah, you need something.
Yeah.
It's not going to be okay to like get up on your own.
No. Yeah. I think even right after surgery, my husband would help me sit me up, manually.
Did you sleep in the same bed as your husband right out of the gate?
Yeah.
You did. See, I didn't because every time he's a tosser, like he tosses and turns. Every time he would do that, I would be like, ugh.
Oh, yeah.
So initially, like right after the surgery, I was all about the recliner, but I liked it because it was situated next to our bed. So we kind of still went to bed together, but I couldn't even be in the same bed with him because when he moved,
yeah,
it was
interesting.
It was uncomfortable.
Yeah. My wedge was wide enough that there was no way he was going to.
You guys were on opposite sides of the bed.
And we have a king size bed.
Oh, that helps.
And so him moving over there, and it's not like a really, it's not like a waterbed, but it's not fluffy. So when he moves, I wasn't terribly concerned.
Okay.
I think I was more concerned about our 5, she was 4 at the time, 3.5, 4, crawling into bed with us unexpectedly, and being awoke from somebody crawling. But
yeah.
But
we have a
outside of
queen.
that-
I feel like the queen was a little too
tight.
You can feel every movement. So
Yeah.
I like it because
Yeah.
we like to spoon, but
Yeah.
not when I'm recovering from major breast surgery.
Yeah.
So
and not that sleep is not epic anyway. Right after surgery, no,
nope, not at all. Okay, so if you're listening to this and you're going to have a double mastectomy, you need to invest in a recliner or a pillow and get that situated because sleep's important when you're recovering.
Yes.
Good quality sleep. Anybody that doesn't get good sleep can tell you how detrimental it is to your well-being, both emotionally and physically.
Yeah.
So invest in your sleep is the lesson here.
Yeah. So before we go on to preparing for your hospital and home considerations, let's do boobs in the news.
Let's do it.
Bibs in the news, bibs in the news, bibs in the news.
So this is a fun segment where we read funny tweets from real people or ridiculous news stories.
All right, hit me.
All right, Beth. Okay.
Let's hear it.
Not all safes contain cash. Oh my gosh, where's this going to go?
Not all safes contain cash.
Not all safes contain cash.
Okay.
Last week, some thieves broke into an escape room business in the Netherlands. While they were inside, they focused on opening an antique safe.
Oh my gosh. Are you serious?
Yeah. I mean, this is real news, people. When they finally got it open, all they found inside were riddles.
Oh my gosh.
That's because cracking the safe is actually part of the puzzle, and escape room participants have to crack it open every single day.
Are you
I bet
serious?
they were really disappointed.
Had they never been to an escape room?
Obviously not.
Have you ever been to an escape room?
Yeah.
You have? Isn't it fun?
It is fun.
It's so fun. Oh my gosh.
So you should probably understand the concept of an escape room before you break into one.
Oh my gosh. Yeah. Boobs.
Boobs. Totally boobs.
Let's do an escape room when COVID's over.
Yeah.
Wouldn't
done.
that be fun?
Done.
Like, let's get our group of survivors and just go have a blast. Maybe some wine and some escape room hijinks.
I'm down.
Let's do it.
Bibs in the news, bibs in the news, bibs in the news.
Okay, and we're back. So we talked about the importance of getting supportive equipment, whatever that looks like for your surgery. Let's talk about preparing for the hospital.
Yeah. So I've had people, mentees, ask me about what they should pack. You know, you have got some anxiety, especially now that COVID has hit. You usually have to have a couple days of quarantining before you go in for surgery. So you're kind of stuck at home with your anxiety of surgery is coming up. And what do I need to, take up my time? Oh, I'm going to pack for the hospital. Well, my response has been there's not a ton that you really have to bring.
I mean, especially in COVID, they're going to get you out of there as fast as they can.
Yeah.
I think you get one night? I mean, I only got one night though.
Yeah,
and that
one
was
night.
pre-COVID.
Yeah.
But I think it's one night and then they send you home.
Yeah. And you don't want to have to be worried about keeping track of a ton of stuff. You're not like
And we should
staying at a
clarify
bed and
too,
breakfast.
because right.
You will get a bed and breakfast, but
Yeah, right. Yeah. It's not exactly the same.
Yeah.
And I mean, I think for our lumpectomy folks, is it the same day?
I think so.
That's something we need to ask.
Yeah, for sure.
Lumpectomy people, if you know, if it's same day, let us know.
Yeah. But you do need to consider some things. So for going home, you're going to need clothes for that. And really what that looks like is you want to consider open front shirts and shirts that are easy to get in and out of. I remember I went to a resale shop and bought a couple of like flannel shirts that were a size extra large just to make sure that I had plenty of room to get into them, because moving your arms around is cumbersome.
Go bigger.
Yeah.
Go bigger, because you're going to have a surgical bra on, you're going to have gauze, you're going to have drains and
maybe a wound back.
oh yeah.
Yeah.
I was a big fan of the zip up sweatshirts.
Yes.
My husband always gets mad at me because I wear more of his clothes than my own. And so his sweatshirts got hijacked right before the trip.
I'm sure he didn't mind.
No, who is he going to really argue with me at that point? I don't think so. I have the upper hand in that scenario.
Right.
Yeah. So zip up fronts or button fronts are critical. You had abdominal surgery, so loose fitting pants, like something that doesn't hit any kind of surgical site.
Yeah, especially if you're getting the deep, just making sure that, if you're going to have any kind of incision down low, you're going to want some loose pants that don't hit that and give you enough room to be able to be covered, but also be able to be comfortable.
Which, I mean, if you have incision sites or you have surgery down there too, you can use like maxi pads to kind of be the barrier between that and your pants. That's a lot of people do that.
Yeah.
Did you get no skid socks from your hospital?
I did, but I'm kind of
Are you anti-skid sock?
I'm kind of anti. Not that I have skid socks, but I don't. Maybe I don't like that feeling on my feet. But I'm kind of a sock prude. Can you say that? I really am picky about my socks, so I brought my own socks.
How am I just learning this about you?
I really like soft cotton socks. I think I bought brand new socks to take to the hospital that were like pretty and soft.
You didn't
and had
find
a
the
nice fit.
grippies to be super helpful for like the first time you have to go to the bathroom and you're not quite sure you're going to make it? Like that is like how you get there.
No.
No?
No.
Okay. Well,
I was putting trust in my muscles to keep me up.
oh, well. Maybe for those of us who aren't quite so athletic, it was more of an issue.
Sure.
All right. So
Bring socks to your comfort.
right now we know you're pro wedge, anti sock.
Yeah.
And I am anti wedge, pro sock.
Perfect.
Yeah. We are so complimentary of each other.
You're the yang to my yin.
We are. All right. So here's one that I did not prepare for, but you are not going to get a shower for a little bit. So if you're like me and have really fine hair and it gets greasy if you just look at it wrong, you might want to wash your hair the day of or the night before and then get some dry shampoo.
Yep.
Others will thank you.
And there's good, clean, dry shampoo options. Something that I did, Beth and I were actually talking about this before we were recording, but after my first surgery, my husband actually learned how to French braid my hair because I like my hair French braided whenever it's wet. We did a spit bath with my head leaned back over the shower. We have a detachable shower head. So that is an option. But if you don't have that kind of help or somebody that's open to doing that, dry shampoo is a really good option. Or, the old baby wipe your armpits and yourself down so you feel clean.
Yeah. I invested in a lot of those wipes, but they're adult wipes. That's how they get you. Like you could literally just buy some baby wipes.
Baby wipes.
I bought the fancy adult wipes, right?
Nice.
Thinking they were different. They're, whatever. Yeah, it is nice to just give yourself a quick freshen up. You'll feel kind of grimy. Any surgery, you kind of feel grimy afterward. You're not going to stay very long, but a phone charger. I forgot my phone charger. I really wish because people start texting you.
Yeah.
I was really out of it for most of the first day, but when you come to and you're bored, having your phone charged is nice. An extra surgical bra.
Something to think about. I felt like I wanted to take a lot, I'm going to need a book. I'm going to have time that's going to be quiet. But
you're so out of it.
Sometimes it's just, if you wake up and you have a moment and you don't have anything to do, that's okay.
Well, I remember my sister-in-law came to visit, and I remember drugs work really well on me. Let me preface it with that. It takes hardly any narcotics, and I am just in another universe. And so I remember just being kind of coming in and out after I woke up from surgery. I couldn't keep my eyes open, but I remember my sister-in-law and my husband sitting next to the bed, and they were just basically ignoring me because I was out of it, and they were just talking to each other. Yeah, I could not have read a book at that moment to save my life. I couldn't even peel one eyeball open. I mean, so yeah, you're not going to be doing some quilting, ladies.
Leave your crochet at home.
Right, yeah. right. This is not the time to journal.
Yeah. Oh man. Okay, so that's really basically it for preparing for the hospital. So for home considerations, I feel like there's a lot more things to just consider beforehand. So when you're at home and you're having that before surgery anxiety, here's some things that you can kind of prepare for that. Getting that wedge again, and then some kind of small pillow. I had 2 pillows. When I woke up, they had given me pillows to put under my arms.
Pillows or pillows?
Oh my gosh, pillows. Pillows.
Okay, I'm just checking. It sounds like you're saying pillows.
It's the fancy way to say pillows.
Okay, continue.
Pillows. So you're going to want small pillows underneath your arm.
Enunciation.
Pillows. I feel like it's a little bit more comfortable if you're not touching, where your drains are coming out. And it's, I don't even know really how those pillows work other than just they give you that comfort of something soft that's underneath there after the trauma.
Yeah, I worked for a company that sold the manufacturing plants, and I will never forget that one of my coworkers, he's just like this man's man, he's just... And when he found out about me having this surgery, his wife sewed me all these armpit pillows and the seatbelt pillow, and it was the sweetest thing, and it really helped.
Yeah,
it really helped. So get the pillow for the car ride home, or just for when you're at home, just stick some pillows under those armpits, ladies. You'll be glad. Safety pins for pinning your drains to your surgical bra.
Yep, I had a D-clip that I used when I did finally get the go ahead to take even.
What's a D-clip?
A D-clip is like a climbing clip. It looks like a really big, safety pin kind of, but there's usually little hooks on the top of your drains, and I would hook all my drains on there and then hang it on top of my shower rod.
Oh, you see those in the hospitals, right? For hanging the IV bags and stuff?
Yes, like that. Yeah.
Okay.
Yeah, it's just a really usually a bigger version of it. Yeah.
Where do you get those? Like Amazon?
Yeah, Amazon, or you could get it at a climbing store, or
my
husband brings them home from jumping out of windows,
Okay. There you go.
Button-up PJs is a really good just for at home. It's going to be really hard to pull a shirt up over your head. So again, just like in the hospital, going home shirt that's easy to get in and out of, or those zip-up jackets.
That was one of my favorite gifts from friends of mine. They gave me really nice button-up PJs. Oh, it was luxurious.
Yes.
I really...
When you're feeling kind of yucky.
Mm-hmm.
Yeah.
Yeah. Let's talk about the drain belt or the lanyard. What did you use?
I used the lanyard. Well, actually, I kept mine mostly pinned to my surgical bra.
What do you do when you shower?
Well, I kept them on the D-clip.
Oh, okay.
Yeah. But I will say since having my surgeries, there are so many cool options out there. I think that there's like fancy robes that they make now with the drain pockets on the inside.
Yeah. You can get shirts with pockets on the inside. You can get a lot of stuff.
Somebody told me about it. If anybody's ever been a server, the little apron that you put around your waist, that's also a really good option for your drains because it holds them right there.
So I just got a lanyard, to hang around my neck, and I was like, oh, I'll just drape it through. It's fine. Except for in the shower, if you're not paying attention, because you kind of have T-Rex arms. Like you're trying to reach your head and you can't really lift your arms. And so you're kind of managing a lot of processes. And I will say that if you're not careful and the bulbs fall off of the lanyard, they drop to the ground and they yank on yank on your incision site. And it hurts.
Yeah.
I mean, it's not terrible, but it's like an annoyance. And it's like, ow,
Yeah.
And then you're pulling them up and trying to get them situated on the lanyard. And then you're almost like worried they're going to drop for your whole shower.
Yeah.
So I mean, you can't even enjoy your shower because you're like, please don't drop drains. So looking back, I wish I would have gotten like a shower belt because then I could have enjoyed my shower more instead of being in constant fear of my bulbs falling out of my lanyard.
Now you know why everybody calls, I mean, at least my plastic surgeon did, but everybody calls them the damn drains. They really are.
And it's a good day,
worst.
ladies, when you get them out. Like some poor women, they don't drain properly. And so they keep them in longer. Like sometimes like we have a woman now that has had them for like a month and a half. That's not the typical. And I mean, I got mine out 2 weeks after, and it was the best day.
Yeah.
And I will say you turn a corner in your recovery once those drains come out.
Yeah, you feel kind of untethered.
Yeah.
Yeah.
Oh, yeah.
Yeah.
Like everything is better once you get those drains out. So you're not alone. Everybody hates their drains. It's just unfortunately part of the process, but they aren't forever. So.
Nope. The next one on our list is, I think, one of the biggest ones, having healthy meals around or help with meals. So setting up a meal train, if you have to set it up for yourself or set it up, through any organization that you're near, is super important because anybody that lives with you, your family members, are going to be busy helping you. Like you are going to be their full-time job. And if you've got young kids like we both did, that's also another full-time job. And then just taking the burden off of meal preparation or just having something you can pull out of the freezer is hugely helpful because you're not going to be able to cook. Your arms, again, T-Rex arms.
Yeah. And it is really, really helpful. It goes to that practical piece. If you're a friend of somebody that's been diagnosed, the practical things like healthy meals is so helpful.
Yeah.
Oh my gosh, it's so helpful.
Or if it's summer, like get your grass mowed. Like figure out how to get your grass mowed or, whatever would make that person's life easier.
And I mean, really, at the end of the day, you just want food, but, healthy foods that can help aid your recovery, good protein, healthy fats. That's really helpful. This one's kind of funny. So I had a friend and she just knew. She had never had breast cancer, but she brought me a bag of fiber, essentially. And I needed it desperately because if you do pain meds after your mastectomy, you are going to get constipated. And anybody who's had a child knows this. It only takes one experience with constipation after surgery for you to be like, never again. I mean, it is worse than childbirth.
Yes, it is.
And so for me, like I started weaning myself off of the pain meds before, I left the hospital because I did not want to have that happen. And this woman was very wise and she brought me a gift bag full of fiber products. So it's not something you think about, but get the fiber, ladies. You will be glad you did.
Front closed bra, that's another one that will be, once you get your drains out, you're going to want something that's easy to put on and to be able to slip your arms in on the side is going to be a little bit easier than over your head.
Yeah, the surgical bra is Velcro in the front. It's ugly. It's bulky.
Mine was zipper.
Yours was?
I think
so.
so.
You got a fancy one. Mine was Velcro.
Nice.
But anyway, either way, when that goes away, you're going to want an open front bra that's comfortable, like a sports bra.
Something soft,
as you recover. And you kind of mentioned this before about your husband helping you in the shower, but this is fancy. I did not have this, and looking back, I wish I would have gotten it, is a removable or handheld shower head. Mm-hmm. Holy smokes, that would have made showering so much better.
Yeah, you can then prop yourself up, use your wedge pillow, prop yourself
in the shower?
up. Well, no, outside of the shower, prop yourself up so that your head is leaning. Your head is leaning back, and then you can use your removable shower head to wash your hair, or you can shower basically from the waist down. It gives you a lot of options with that.
Yeah, that's fancy.
Head.
I wasn't going to make the investment in that at the time, but looking back, I'm like, that would have been really nice to have. Drain records. So they're going to give you a sheet, but I ran out of room pretty quickly. So if you have just like a little notebook to record your volumes, because they will not let you get rid of your drains until your volumes are reduced.
Yeah. I added this one to the list because I found myself wishing I had done it after the fact, but when you do get your drains out and you start getting released to do a little bit more and you're feeling a little bit more ready to do it, putting things at a height that is accessible to you. So in my laundry room, and this is a very specific situation, but in my laundry room, I keep my detergent. I have to reach overhead to get it. Mm-hmm. And I just remember one day being like, okay, somebody loaded I think I maybe even recruited a kid to load the laundry. And I was like, I can start this all by myself. And I was feeling so proud. And then I was like, I can't get the detergent down.
Did you get a chair?
Yeah. Well, no. I mean, I don't even remember what I did, but I maybe just probably walked away from it. But
forget you, laundry.
Being able to just, when you can finally get a little bit of release, but you still are having pain when you reach up overhead, just being able to have that stuff kind of at an accessible height, it's really nice to forethought.
This isn't about the checklist, but I want to know your thoughts on this because you are a exercise person. My first week, is rough. The first week is rough. You're kind of coming off the surgery and, but after that, like after week 1, I was walking the neighborhood. Were you?
Mm-hmm, mm-hmm, yeah.
And it really helped. Yeah. I mean, I'm not saying that they were like, 10-mile long walks, but it really helped me recover quicker. And everybody's different. So you got to ask your doctor about what physical activity is appropriate for you. But walking as soon as I possibly could and getting moving really helped aid me.
Yeah. I'm always going to be a supporter of early exercise. Even when you have, any kind of injury or surgery. I was walking like 2 days post having a baby. So I'm very much a proponent for it. But I think that it depends on the time of year. Because a lot of people will say, I would really like to go for a walk, but it's February and snowing outside. Like, it just depends on, is it appropriate for you? Or would just be going downstairs and, like walking around your house, is that going to be great for you? Or if it is sunny outside, that sun is going to add a little bit of extra pep in your step too. So it just depends on the time of year. But yes, activity is...
You are right,
so
because
important.
I had my surgery in the spring, so it was weather appropriate to take some walks.
Yeah.
Yeah, you got to figure it out. We are going to talk about the role that exercise plays in your recovery in a future episode. We're going to have a special guest. I think it's going to be really good. So we'll get more into that. Before we recap, let's hear from our second sponsor.
SSM Health is a proud sponsor of the Besties with Breasties podcast. 1 in 8 women will be diagnosed with breast cancer during their lifetime. Early detection is key, and keeping up to date on yearly mammograms could be life-saving. At SSM Health, we offer patients in the St. Louis area online scheduling for mammograms, including next-day appointments. Visit ssmhealth.com/schedule-mam to make your appointment now.
All right, and we're back. So just to kind of recap the episode that I have been so excited to record, preparation is important to ensure, a stress-less recovery. Yes. So there's always going to be some kind of stress, but just making sure that you've aligned all of everything for home and then everything for the hospital will make it a little bit easier.
You know what I think we need to say too is that if you don't have a lot of social support, if you don't have family or friends in town, because we do get a lot of women that they live in a separate state from their relatives, this is the time where you need to recruit help and services. So that's when I'll really point to other nonprofits who provide that practical support. You need to kind of build your team and get an army of people behind you. And it's critical. So if you find yourself with a lack of social support, you need to reach out and let your nurse know and reach out to other nonprofits and recruit people at your job or your church or whatever you need to do to ensure that you get that support. Because just because you can do it alone doesn't mean you should. I mean, do you agree with that?
Oh, for sure. And I think this is going to be, we've added an episode that we're going to be talking about here. And, I think it's a couple episodes from now. It's just accepting help and what that looks like. And knowing when to ask for it. It's super important. So that will be something that we are going to be touching on. But this is definitely, Beth and I both shared about how helpful our husbands were and just getting meals dropped off and leaning on other people.
Lean on the people.
If you found this checklist or this information that we provided for you today helpful, or you think it would be helpful for someone, we have created a PDF version of our checklist for you to gift or to download for yourself to prep for your surgery.
That's actually a really good idea. If you know somebody that's diagnosed, you could print this off and put it in a little basket full of goodies. So where can they find that, Sarah?
They can find it on our socials, so on at SJ Hall Coaching or at Faith Through Fire, or we are going to attach it to the episode notes.
Next time, we're going to be talking about infertility. So this is a big topic in breast cancer, especially for young survivors. So a lot of times because of treatment, family planning options are taken off the table. And we're going to have a very special guest who's going to talk about the different options for young women diagnosed with breast cancer who want to preserve their fertility. So until next time, guys.
See ya.